coordinators for the West Kentucky Healthcare Coalition. So our healthcare coalitions across the state, there are 8 of us, and we work together to support healthcare facilities and the overall healthcare infrastructure during an emergency or a response. So some of the things our coalitions do, each of the 8 of us, so again, we are regional coalitions. My West Kentucky Healthcare Coalition covers the far 24 counties of West Kentucky. If you are in Lexington area, that would be the Bluegrass Healthcare Coalition. If you're in the Louisville area, that's the Hera Coalition. Bowling Green is Heart. You can look us up on the KDPH website just by Googling, emergency preparedness and response branch, and that will get you to the coalitions and how you can find the coordinator to the coalition that's within your region. What we do as a coalition is we exercise, plan, and train together. And we also bring forth a whole group of educational offerings and trainings throughout the year to focus on the safety and readiness of facilities. And in this case, we are going to work on supporting independent living through safety and readiness. So why is emergency preparedness important, and why does it matter to fall prevention? So first off, I'm going to tell everyone on this call that September is National Emergency Preparedness Month. And it is so important that we help those that need assistance preparing, but it's also so important that we prepare ourselves personally. As a responder, I know that if I know my home is prepared, I'm much more ready to go out and help other people if I know that my family is safe and ready to go for an emergency. So there's always going to be that component of personal preparedness. So why does it matter for fall prevention? Because older adults are more vulnerable during emergencies. Falls increase during chaotic events. So this could be like storms or evacuations. I know as a middle-aged individual that if I am rushing to do something, I have a tendency to trip over myself, stump my toe, all these things that could be much more critical for an older individual. And then emergency planning supports independence and reduces injury and risk. So I also want to highlight the importance of disaster preparedness for the older population, some different strategies for those living independently to keep them safe during emergencies, and then to discuss potential challenges and what to expect in various disaster situations. So here's the connection between falls and disasters. Obviously, power outages increase fall risk. You definitely have to use that poor lighting, but in a power outage, if it's extremely hot, you might have to deal with dehydration or just overall heat weakening. So that could lead to an increased risk as well. Evacuations, again, it doesn't matter if you are young or if you are old. If you are rushing to get out of a location or you're in an unfamiliar setting, you are more likely to fall for sure and to hurt yourself, to bump into something, to trip over something. And then medical equipment access may be compromised. So during a disaster, if it is a tornado and your walker blows away, or you lose your cane, or your wheelchair gets destroyed, all of these are going to contribute to the potential for falls during a disaster. So we have to look at some of the vulnerabilities of older individuals during disasters. You have those physical limitations, the mobility issues, frailty. You also have sensory impairment. So if they have vision problems or hearing problems, that all could contribute to a potential fall. Cognitive impairment such as dementia or Alzheimer's, chronic health conditions, heart disease,
Yeah,
diabetes,
okay.
limited ability to respond quickly in emergencies. And then we always look in older individuals, the social
I'm
isolation,
trying to get my blood pressure under.
and the need for caregivers to provide them for
Yeah,
assistance.
okay. So do you have
So, some different types of disasters that impact the elderly could include, and this could actually impact all of us, not just the elderly. So, those natural disasters. The state of Kentucky is like the top 15 states across our nation over the last 5 years to have emergency declarations. I'm pretty sure East Kentucky is in the top 10. Hazard has probably made the top five because there's just a lot of stuff that's happened in Kentucky the last 5 years. Floods, tornadoes in the West Kentucky region and the Southeastern Kentucky region. We are always planning for earthquakes. We definitely do not want the New Madrid fault situation. The man-made disasters that we deal with on a regular basis. So power outages, um, cell phone towers. If you can't contact your loved one or connect with someone, that is an emergency in its own. Again, I say this for older individuals, but I also think about my 16-year-old daughter. If she didn't have access to her cell phone, for her, that would be an emergency. And then like hazmat spills. So, how many of these individuals are living near a major roadway that trucks drive down where chemical spills happen? There might be a need for an evacuation there. Of course, medical emergencies, we've all dealt with, COVID-19, the pandemic. And then, we're living in a world of civil unrest and where active aggressors are on a regular basis. So again, that could really affect um, just anyone in the population. So, what are some strategies that we work with? Um, Emergency supply kits with mobility aids. So that's just being creative with how we can assist people. So instead of making a go bag or an emergency preparedness kit that's got flashlights and batteries that need to be replaced, let's look at maybe including headlamps into that. That way, an older individual might be able to put on a headlamp and still use their cane, walker, or wheelchair without any difficulties. For this one hits home for me. Backup power and battery backup for lift equipment. I think about my 92-year-old grandma who, majority of her days are spent in her remote control recliner. You know, I think about, well, if the power went out and that recliner didn't lost electricity, and then of course my mom says, well, it has a battery backup. And I'm like, okay, so how often are those batteries checked? Because I can't imagine my grandma, she's a larger gal, and I just can't imagine her being able to get up out of that chair on her own. We also look at home hazard checks. It is just like what you would check if you were bringing home someone new to your environment. Are we securing the rugways? Um, do we have clear paths? My husband's grandmother collected magazines, and all of her magazines lined her stairwell. So it would be nothing for her to, step on a magazine and slide down the stairs. And then a communication plan with neighbors or caregivers. Because again, we have to reach out to those living independently that are older and make sure that they are being taken care of. So these individuals need redundant ways to communicate. And what a redundant communication might look like is, are they using a cell phone? Do they have a landline? A lot of older individuals have hobbies, right? And I've found that older gentlemen like to use ham radio equipment. and they monitor the ham radio waves. So do they have access to that kind of equipment? And then ultimately a buddy system. So I live 2.5 hours away from my mother, and I talked to my mom every day. And I did not talk to my mom on Monday. And I did not talk to my mom on Tuesday, not because I wasn't calling her, but because she wasn't answering. Luckily, I have a brother who lives very close by. So on Wednesday, I say, "Hey, bro, I haven't talked to mom in a couple days." And he said, "She's fine. She stopped by earlier." So just making sure that they have that buddy system in place. So also having emergency plans. So develop and update these emergency plans. So in healthcare facilities, we have what's called an emergency operation plan. And that plan goes into a very large binder, and it is put on a shelf to collect dust until there is an actual emergency. And then we can pull it out and we can access all the information that we need. Do that for individuals that live in home by themselves and independently. Go ahead and make that sheet of information that has their doctor's contact and their cardiologist contact and their gastrointestinal doctor's contact and their daughter and their son's contact information. But do more. Don't just write that information down. Write that information down, laminate that information, because it's great to have that information written down, but it's not great if there's a hole in the ceiling and water is coming in and the print on that paper is ruined, or there is flood water coming in and that paper falls on the ground and you can't, it's illegible. So laminate that and then put it in something. So put it in a red binder. That way it's like red emergency. I'm going to go to this red binder. Put it in a tote within their emergency preparedness kit. That way it's easy access. Make sure that it is labeled and you just know where that's at, and that the buddy or the neighbor or the son and daughter know where that's at. And then include in that patient or individual specific needs. So are there medical conditions? Are there mobility restrictions? Are there communication preferences? Because we need to know that information during an emergency. And then practice it. We always fall back and spring forward, and those are the times that you're supposed to check your fire alarm. We do drills within hospitals and healthcare facilities. I do drills with my 7-year-old son. If there's a fire, go to the mailbox. If there's a fire, go to the neighbor's house. So they know what to do in an emergency. That is no different for anybody that's living independently. You need to have a plan on what to do if there is an emergency. Again, just for preparedness, those personal emergency plans are so important. Always identify a trusted friend or family member as an emergency contact, because in an event that you cannot get to your loved one, or they cannot get out, have someone that can do that wellness check on them. And then ensure that that individual knows how to call for help and has access to emergency numbers. That's that laminated binder we talked about. Again, don't sleep on go bags and emergency kits. If you have a first aid kit, that's great, but let's up that first aid kit a little bit. So again, packing essential items such as medications, important documents, basic first aid supplies, and then include those special support needs. So the dentures, the hearing aid, the glasses, do not sleep on those, because if there is an individual that's evacuated and they don't have their dentures and they go into a sheltering situation, you're going to have some dietary restrictions if they can't eat food. And that could cause a whole slew of medical problems if they're not getting the right nutrients. And then home safety modifications. So adding the handrails, the non-slip mats, testing those smoke alarms are all just very, very important. Some things that we have to expect during a disaster with independently living seniors is that potential for isolation from neighbors and then difficulty accessing emergency services. And then with that, once they do evacuate, there's some issues with relocating them, especially if there are mobility limitations. As far as community outreach, I really encourage just senior centers, the independent living agencies to incorporate emergency preparedness into your culture. So provide offerings at your senior center that help seniors build a preparedness kit. There are quick YouTube videos that you could watch. Again, this month, September, is National Readiness Month for emergency preparedness. Ready.gov has a large amount of information. You can get infographics. You can get Facebook messaging. All of this is on ready.gov that you can share with your participants or those individuals that you work with. And then create and promote community networks that regularly check on elderly individuals during disasters. So what that might look like is your Meals on Wheels program, doing an emergency preparedness education when they do those weekly stops or visits. It does not have to be anything long. It could be short. What we do is we call these micro exercises. I don't know if any of you are familiar with ChatGPT, but you can use a little AI and you can put in the prompt, create me a micro exercise to teach homebound individuals how to respond during a tornado. And that prompt alone will give you, 2 pages of information that you could share. You could put that in a short infographic. You can put it in a 1-page document, but be sure that the agencies that you work with are sharing that information. And again, during an emergency, like government and emergency services are your friends. So if you are an independent living agency, build relationships with your EMS director, with your county emergency manager. So I'll go back to the tornadoes in 2021. We worked with an FQHC, so that federally qualified health clinic. So in the summer, early fall of 2021, there was the Shot for Hope. And I don't know if y'all remember the Shot for Hope, but that is when the vaccine became available to the elderly population. And the government pushed the Shot for Hope through the FQHCs to reach those homebound individuals. So in Muhlenberg County, where Bremen, Kentucky is, and Bremen lost 11 individuals during the 2021 tornadoes. And 11 individuals doesn't sound like a whole lot, but in Bremen, Kentucky, that is like 10% of the population there. It is a very small community. So what that FQHC did is while EMS were doing the emergency response and evacuations, the FQHC did home checks on those homebound individuals that they had just met a few months earlier, giving the Shot for Hope to. So partnering with, is there a question? Okay, so partnering with your county emergency managers to let them know, like, this is my agency, this is what my agency does, and these are the individuals that we work with. We might have their home addresses that we can, provide during an emergency situation to offer those wellness checks. But be sure that you're working with those government and emergency services agencies. And then offering programs. You can do, there are caregiver training programs that provide specific disaster preparedness training for caregivers and family members of elderly individuals. Ensure that caregivers are prepared for evacuation and have the knowledge to care for special needs. Again, that personal preparedness, we have to push personal preparedness for the caregivers. So when they are prepared in their own homes, they can provide assistance to these individuals that need more assistance. And always, I'm a big fan of resources and materials, especially with the older population. I've noticed, I work some health fairs and different things, and I've noticed that older individuals do tend to pick up more pamphlets. So just making sure that if you are pushing any information, that it is, bolder font, maybe a little bit larger font, something that's a little easier for them to read. So I've got a little exercise, and if we could use, actually, if y'all have any input, just go ahead when I ask a question and unmute. I'd like to talk through this exercise with you all. So our scenario is a tornado warning at an assisted living apartment complex. The date is May 22nd, and it's at 3:30 p.m. And the National Weather Service issues a tornado warning. Residents must shelter in place or move to designated interior areas. I will say for independent living individuals, sheltering in place is always an easier option if it's the best option. So if everyone could just hunker down for a little bit versus moving them out of their homes, it is easier, but again, it might not be the case in all scenarios. Oh no, the electricity goes out. Something's going to happen. The hallway lights are dim. One resident with a walker is unaccounted for. The elevator stops functioning, which is something that, we don't always think about, but in apartment complexes, if an individual lives in a complex, there's a good chance there's an elevator. Staff report that one resident fell in the hallway. So it doesn't have to be residents. This could be anyone. How would you locate and assist all the individuals that you work with? So what are the processes for your agencies to assist the individuals that you work with? And feel free to just come off mute. So I would think maybe some wellness calls would be beneficial. I definitely, with my grandma, would be calling to check on her, making sure that everything's okay. And then what fall prevention measures are used during shelter in place? So this isn't an evacuation. So what are some fall prevention measures that would come in handy if your elderly grandma's power went out? Bueller.
For them to have extra flashlights and batteries in the area, or as you mentioned earlier, the headlamps.
Right. Headlamps would be great. If you could go, if you know the power is going to be out for a few days, I mean, it's May, right? So the date was May 22nd. We're just going to say it's not too hot. It's not too cold. So we're not going to have any heat emergencies, and we're not going to have any, cold hypothermia emergencies. So we're going to say that the weather is temperate. Your family member is able to shelter in place, and they might be without power for a day or two. So you might go ahead to their house and just pull up their area rugs and pull up the runners in their hallways if they have those. Any other ideas?
Another thought is, Lynn Harrelson, another thought is making sure that food is available that doesn't require cooking.
Yeah.
And I think of my disaster plans that I've lived through, the hurricanes and tornadoes, and the baked beans or pork and beans were great. All you needed was a can opener, a hand can opener, not an electric.
And interesting, I'm glad you brought that up. So gastrointestinal infections are very common with the elderly, independent living individuals after an emergency. So they come from the era of let's make do with what we have. And some of them are on a fixed income, some of them get Meals on Wheels. But what happens is that electricity goes out, their freezer thaws or their refrigerator warms up, but they still continue to eat the food that they have because their funding won't allow them to go grocery shopping again. Their next Meals on Wheels isn't until next week. They don't want to waste because they come from an era where waste is not a thing. So always making sure that is taken care of, that if things do thaw, their refrigerators and freezers are cleaned out and food is disposed of. Who communicates with families during and after the storm? So for those living independently on their own in their homes, we always want to think that their families will reach out and check on them, but pulling in that senior citizen center in the area that can provide assistance with, just calling to check in with individuals. Again, reaching out to that county emergency manager, especially if this individual is electrically dependent. So they might have oxygen concentrators or are doing at-home dialysis, something like that. If they are electrically dependent, especially if they are Medicaid recipients, they get something, I cannot think of what it's called. There is a map and it is on, I can't think of the website. Starts with the E. Anyway, there's a map for Medicaid individuals who are electrically dependent, that they get populated, and that county emergency manager can access that information and know how many electrically dependent individuals are within their county. And then it gives like a vague pinpoint to where those individuals are. So it doesn't give exact addresses, but that emergency manager can ask for a request for that information and the federal government will send that to them. It does only cover Medicaid. It does not cover Medicare. But that is something. And if I think of what the name of that website is, I will send it to Roy and he can send it out. That way you all can see it. It's pretty cool, especially from a planning standpoint. Next question is, how can fall risks be further mitigated in future emergencies? So what can we do on a regular basis to make sure that people aren't falling in their homes? Any ideas? So this whole time, nothing has been brought up about generators. And the thing about generators for older individuals is a lot of times generators have to be fueled. Some of them have push buttons to start. Some of them have pull strings to start. There are now generators that are smaller, more compact. My grandma has to be prepared. I don't give her the option to not be prepared, but she has a small Jackery generator that you can buy off Amazon. It is solar powered and it fits in her walker pouch. So she has a walker and the seat lifts up. And so she has a generator that fits in there. So if she needs to plug something in, she has easy access. It's very portable for her. So just making sure if she needed to plug in a lamp, she has the access to do that. I also would recommend if you are working with elderly individuals, should you happen to get any grants that you could buy something for those independent living, I really encourage a solar powered cell phone charger because a lot of individuals now, so they have those alert systems that they can push a button. My grandmother, she refuses to do that because at 92 years old, she thinks if you have the push button necklace, you're old. So she's not going to be old. So we have settled on her carrying her cell phone with her in her pocket. But let's say she falls and her cell phone goes dead. So now she also has it's very small, very portable, solar powered cell phone charger to go with her where she goes. So just thinking out of the box, I think it's very easy for us when somebody says emergency preparedness, they think, oh, a case of water, a couple cans of canned food. We think about canned food, but we don't think that everyone uses electric can openers now. And the elderly population can't use the hand crank can openers. So there's just a lot. Emergency preparedness has really evolved, and there's a lot more to it than that case of water and the couple cans of food and the first aid kit. So really diving into what we can do to help this population. So some key takeaways that I hope you all got from this presentation is that emergency preparedness must include fall prevention and planning. So again, as much as I would like emergency preparedness to be a culture in fall prevention, after doing this presentation as an emergency preparedness coordinator, I feel like fall prevention must be a culture inside emergency preparedness too. It's a two-way street, and we need to look at it like that. Again, those micro exercises that I was telling you about, practicing scenarios strengthens response and saves lives. So practice, practice, practice. Again, with the elderly population, especially those living independently, make sure they know the process. If they have a fire in their home, to go to the neighbor's house. If they have a fire at their home, to grab that red binder so they have the contact information when the fire department shows up, to call their son or their daughter. And empowering residents to prepare equals safer independent living. Just overall, it's just safer independent living. It's safer living for all of us. Just do the things, buy the kits, prepare with your family, practice, practice, practice. Coming from someone that has never been afraid of tornadoes in my life ever, I responded to the 2021 tornadoes, and now when there is severe weather, we are sleeping in the basement. My children are going to bed with tennis shoes on. I thought I was prepared before, but then when something happens and you experience it, you learn and you grow and you become even more prepared. So that is what I have for y'all. Do you have any questions for me? Because I love talking about this and I would love to answer any questions that you have. And Roy has a question. Go ahead.
Well, actually, I have two, and this is
Okay.
based on life experiences lately. One is a neighbor, and I think many of us do this. We take pictures or video the inside of our homes for insurance purposes.
Yes.
And that way we store the files on our phones or on a drive or something, hoping nothing ever occurs where we have to show the film to the insurance companies. But the thinking about this one person was they did some modifications because the elderly parents kept falling and one had Alzheimer's. So modifications were made to the bathroom and some other places, bedrooms, and a couple other places in the house. And reflecting on that, if they ever had to show those films to pictures to the insurance company, the updated modifications for fall prevention for living enhancements would be present. Then they could be reimbursed for the current modifications or maybe even better ones once repairs or even a new house is purchased. Because one cannot always remember everything we purchase, all the clothes, all the knickknacks, all the books, and so on. And one may forget, well, we installed a new tub with handles and seats and everything else. It may have just skipped somebody's mind during the process of filling out the paperwork with the insurance company.
So, interestingly enough, I also teach Dave Ramsey's Financial Peace University. And with insurance, you know, your home is covered by a certain amount. You don't always have to provide documentation. So it's good that you do provide documentation, but you don't always have to provide documentation. However, I will say, check your insurance policies, because when you make those modifications, if they are substantial, you might have to raise your insurance coverage. So just kind of keeping that in mind to how much your modifications are.
Good point. The other question was, I'm from Eastern Kentucky. Many of the family members, we still use landlines, just can't get cell phone reception. And you mentioned correctly, you were on target about communication. And I'm thinking about all these people back home calling into the nursing homes, 911, and everybody, the local sheriff's department and everybody else. It seems like the system would get overwhelmed very quickly trying to reach loved ones, the elderly in particular, to find out, is there some mechanism where this is sorted through, or you just work through the process and
So
hope? I mean, how does that work?
I can do this on two separate ways. Across the state, there are these devices. There are multiple devices. So plum cases, PLUM, and those are cellular boosters. And we use these during the Marshall County school shooting. When you have a situation where children are frantically trying to reach out to their parents, parents are frantically trying to call into their children, it is clogging the cell lines for responders to do their jobs. So we use this device called a plum case, and it's got secured lines on it. And so it is for responders. So in an event of the flood, to help alleviate some of the traffic, responders kind of push themselves onto this plum case, and that gives them more, it pulls cell service from a cell tower outside of the affected area. So it pulls service from further away, so they're still able to communicate with one another, and it opens up services for other individuals to call just within that area. So for a mom to call a daughter situation. Also, we are in the world of Starlink. That can be bought by personal individuals to boost their services. It can be tapped into a landline as well, from my understanding. A lot of emergency service agencies are moving to Starlink also. It pulls from a satellite service way out there in the world, way out there in the atmosphere. So there are things that are being done to help with that. There are things that can be purchased. Again, it depends. What are you willing to pay to have these different contraptions? Okay. Any other questions?
This is Steve. We have a couple in the chat line if you want to look at. Dana was asking, are there trainings for caregivers offered by your agency?
So I have never done a caregiver training before. However, I have seen that there are caregiver programs Um, again, I have not, no. I really focus more on like the healthcare infrastructure and not individuals.
Okay, thank you.
I'm sure you could Google one and probably find a couple from FEMA, I would say. So at least.
Nicole asked, wow, what's the name of that generator again?
So it's a Jackery, Jackery, and they vary in sizes and they vary in weights. You could get even, like I said, a small charger for your cell phone that is Jackery. I can't really promote brands, but it's a reliable brand, and our coalition has purchased it for a couple agencies as well.
Okay, thank you. Shannon earlier raised her hand. Do you have a question? Oh, she said no. Okay. That's all we had in the chat. We had a couple of thank yous. So thank
Well,
you very
thank you
much.
all. I appreciate it. And here is my email address. Um, if you would like to link up with your healthcare coalition coordinator, just email me and let me know what county you live in, and I can share that coordinator's information with you. It is a wide variety of trainings and exercises we do. So for our coalition in West Kentucky, we meet on a quarterly basis, and we try to find speakers that are going to speak to a large group of people. Again, we have EMS, emergency management, local health departments, hospitals, long-term care facilities. So our last meeting was in August, and we had someone from NETEC, which is the National Emerging Special Pathogens Organization. Our next meeting is in November, and we are going to be doing like micro tabletops as groups. So it's going to be like a full exercise day. We also have a medical response surge exercise coming up in October. That's going to be earthquake focused. So each coalition does something different. Some meet on monthly, some meet every other month. We meet quarterly. And then the exercises are always different. The trainings offered are always different. So just being linked into them, it's a good networking platform to really meet your county emergency managers and your EMS directors, and get to be on a first name working basis with them. It's very important.
Yeah. Okay. Very good. Very good. Thank you.